current work within the Amsterdam UMC Department of Plastic Surgery, in particular within the gender surgery practice, where we have been developing a set of core outcomes for genital gender affirming surgery over the past years. And today I'll be sharing with you what a core outcome set is and how we can, through this instrument, measure what truly matters in research in general, and in particular, in my case, in surgical research and in gender affirming care specifically. I think we can keep any questions for the end of the presentation, but please, if you have any troubles or if anything is happening and you are, feel free to just interrupt anytime. I have nothing to disclose. First of all, let me just start by a quick definition of what a core outcome set is. A core outcome set is an instrument, an agreed standardized set of outcome that should be measured at a minimum in all clinical trials in a specific areas of health or healthcare. This is the definition by the COMET initiative. I will be referring to this specific organization multiple times during the my presentation, and it is the initiative created some years ago to ensure and to develop this specific set of core outcomes in different areas of healthcare. What I want you to take from this slide actually is that these are a minimum requirement in all clinical trials, meaning that they should all be reported, but there is no maximum in the sense of how many outcomes you can measure in your trials. But this should be the core. So what should always be measured, and I think at the end of the presentation you will have a clear idea of why this core is so essential. But just to mention this from the beginning, it is essential to ensure that the studies remain comparable, they may remain relevant, and they are all usable for synthesis and for meta-analysis. If we all measure the same things in the same way, we can then combine data and summarize the evidence. Essentially, this is the key concept here. What are then all the advantages of having this set of essential outcomes in research? Well, I already said this, but it increases consistency across the trials. It also maximizes the potential for each single trial to contribute to evidence synthesis, so systematic reviews and meta-analysis. It is much more likely that these outcomes are measuring what is relevant both for the clinical condition that we are analyzing, but also to the patients and to the population that we are analyzing, because these tools have been selected and developed within the population. So it's more likely that they perform really well, essentially. And also they reduce the selective reporting, so useless data, or that they only increase the burden for clinicians and researchers or patients, and they reduce these at a minimum, at a core, essentially. I already mentioned the core outcome measurement in effectiveness trials. That is this initiative that has been developed with the aim with different aims that you can see summarized in this slide. First of all, to raise awareness of current problems within the clinical trials and how they are, and how outcomes are selected for each of these clinical trials. Then to encourage the development first, and then the uptake of the different sets of core outcomes that have been developed. Then to promote the development of these core outcome sets, to provide the resources to facilitate these, and I will touch upon this in a moment, and to avoid, of course, unnecessary duplication of core outcome sets, basically, to avoid different teams focusing on the same health conditions that for which, for example, a core outcome set can already exist. and also then to encourage evidence-based development of this core outcome set. In particular, I would like to just touch upon the second last point here, which is avoiding unnecessary duplication effort. There is a searchable database on the COMET website that I have here in this picture on the right, and you can look on this website for all the core outcome sets that have been developed over the years. Whether you are developing a core outcome set, is good practice to first check if one of those has already been developed. When you are conducting a clinical trial or specific studies in a healthcare area, it's also good practice, and we will see this in a moment, to check if there is already a package of core outcomes out there that you can freely use, and it will also facilitate your work a lot. What is the current situation with those core outcome set? I'm so sorry for my voice; it's a bit it's a bit not at its best, but the flu until yesterday, unfortunately. The situation so far has been progressively increasing over the years. In 2018, we had over 400 sets that were developed in different areas and different populations. And many studies are working on set, so this is why it is good practice for you to check if any of those have already been developed. I was mentioning before that one of the aim of the COMET initiative was providing guidelines, providing a guidance on how to develop those sets, and here you can see some of those guidance documents. The handbook, for example, that is a very good summary of all the steps and elements that are necessary to develop those instruments. And then there are different other publications that I have here in the slides. For example, this is a protocol items. It's more like a checklist of all the items that should be there in a protocol for developing a core outcome set. And then there are also some standards for both the development of this core outcome, but also for the reporting of those sets of essential outcomes. Essentially, you can again check the COMET website. There are really a lot of really relevant resources out there that you can check for having a better overview of this topic, but also whether you are thinking of developing one of those sets. What progressed over the years, these core outcome set have increasingly being recognized by different organizations, both the guideline development organization or industries or editors also, but also regulatory agencies such as the FDA or the EMI in Europe, but also by systematic reviews, developers and initiative, and also the trialists, and in particular the SPIRIT guidelines are very important for clinical trial design and execution. So all these organizations are now recognizing the role of those core outcome set in clinical trials, and even more, they actually recommend to check before starting or before even thinking of a clinical trial, to check whether a core outcome set has been developed or has been developed, and to include those essential outcomes as a minimum again in the clinical trial, and then focusing on additional relevant outcomes if necessary. Here I have some data on one of the earliest example of those core outcome set, one for rheumatoid arthritis. Has been developed in 1994, if I'm not mistaken, and since then you can see how It has been progressively uptaken in different systematic review, different clinical trials and systematic review. And this is a clear example on how these tool, they require time, of course, but those tools can really change practice and facilitate both research for the researchers, but also improve the evidence and eventually the patient care. After all this discussion on how and what a core outcome set is and what are the advantages of having such instruments, I'd like to quickly go into how we go into the development of those tools and what we have done actually with the GenderCOS, and I will provide you with a clear example on how a core outcome set is developed. First of all, there are two different phases as recommended by the COMET group. The first phase is defining the core outcome set, so the essential outcomes that should be reported, assessed as a minimum in all clinical trials. And the second step is focusing on how to assess those outcomes. Both these phases are essential, they are consequential, and they follow the same structure. First, we identify what outcomes or what measurement tools are being used in a specific clinical condition and a specific population that I am addressing. And then there is a consensus process on those outcomes or outcome assessment modalities to select those essential tools, essentially, that we want at the core of our set. In the case of the phase one, we call it what to measure because it gives us the core outcomes at the end. Phase two, we like to call it how and when because it gives us the assessment modalities, the methods of measuring those core outcomes. We identify all the possible outcomes that have been used in all the clinical trials in our specific health condition, in our specific population, and then we undergo a multi-phase consensus process to select those core or key outcomes that should be reported in all the clinical trials from this moment on. Second phase, for the list of core outcomes that we have identified in phase one, we again go into the literature, screen all the clinical trials, all the evidence that we have collected so far to check what are the ways, what are the methods that people have used to assess those outcomes. And then we again set up a consensus process, multi-phase consensus process, where we select the best modalities to measuring those outcomes, essentially, those core outcomes, essentially. And this is what it looks like in general terms. When we started with our core outcome set, first of all, we defined what were our the condition that we wanted to study. In our case was genital gender affirming surgery, that is all the bottom surgery performed to align the genital anatomy of an individual to their gender identity. And then we define also the population that in our case was transgender and gender diverse patients or individuals. These are essential before starting with the tools, defining the condition and also the population. As you can see, there has been an increase in the publication in gender affirming surgery in particular, and the same is true for genital gender affirming surgery. And the situation out there was quite heterogeneous also for what affirming surgery trials. Unfortunately, what we also have seen across all those outcomes was an underrepresentation of the population, so of transgender and gender diverse people in the development of those outcomes, so of those scales, those instruments that were used. This was a problem, of course, because both limited our ability to perform comparative studies and meta-analysis, and also, of course, limited the improvement in evidence base, in the evidence base. And this is why we started with the GenderCOS project. GenderCOS project that involved, as I mentioned before, a multi-phase consensus process, collecting experts in the field from all over the world. So you can see here over 10, say over 15 different countries have joined with experts in the field from different expertise also. And this is the final set, the two actually sets of core outcome. One for the masculinizing surgery, so those aimed at a male anatomy, and the feminizing surgery, so those aimed at a female anatomy, basically. And this is the final. These are the final lists of core outcomes: 10 for the masculinizing and 11 for the feminizing ones. It's not really important here to focus on the single instruments because it's overly specific for you now, probably. But as you can see here, basically those 10 or 11 items were selected after this extensive consensus process from the list of those over 2,000 different outcomes that were seen in the literature. After this phase, we moved to what I call phase 2, that if you remember was on the how and when to measure those outcomes. Now we have the list of essential outcomes that we should include in all the trials. How do we assess those items? And this was the question that guided phase 2. We concluded recently also phase 2 after a multi-phase consensus process that was similar to the one that we did in phase 1. And as you can see here, again, I will not go into much details, but basically we reached consensus on the best modalities to measure those core outcomes, and also on the timing recommendation to assess the outcomes in our research and clinical practice. And actually, the last thing that I wanted to mention for our project was the end result, what we have done. I think this is actually very it gives you a really clear idea of what those instruments at the end could look like, because it doesn't stay only theoretical. But here you can see that one of those core outcome, which is in this case flap necrosis of the neophallus, and with the respective modalities and assessment recommendation that are here: physical examination with all the required reporting, so the characteristic that should be reported together with the outcome, essentially. And as you can see here, this is really a core also in the additional information that we provide with the outcome. These are only the essential and really needed information, nothing more than what is truly essential for research purposes, at least. And this is what our tool at the end look like. There is a fully developed checklist that people can download from our website, and when the last paper will come out, I hope soon, it will also be included in the supplementary of the paper. People will just download this checklist, and it will be ready to use for their clinical practice and research, and really will facilitate research in the field, and also the assessment of such a broad range of surgical procedures, essentially, and outcome possibilities out there. And also the second aim is to actually also develop a web-based application, something that is even more user-friendly to have there. Yeah, and this is the what we concluded with our GenderCOS. We now have a ready-to-use tool that includes both the core outcomes, that is the what you should measure as a minimum, and also the how and when to measure those core outcomes. This is again ready to use. You can just download the checklist and you can implement it in your everyday research, of course, but also clinical practice if you wish. And of course, this also requires a lot of participation from the researchers, first of all, the clinicians, and all the people out there performing research in gender surgery. And if there is any of you here in the field, of course, I will also have you on board with us. Concluding in general about the core outcome set, what we have seen in general terms, and what I want you to bring home with you, but also in your future research, because now we are at young stages of our career, but for your future research or clinical practice, if you are in the clinical field, is to check for those core outcome sets in your specific healthcare condition, your specific field, because they probably already exist or they are being developed and they will be out soon. And also trust them because they have been developed using a very specific, long and standardized protocol. And just use them, because not only it will facilitate a lot your research effort, your protocol development, because it's already there, everything is already there, what you should measure, but it will also eventually strengthen provide comparable and meaningful results from your trials, and I will stress the comparable here, but also strengthen the evidence and, of course, what we all want, improve patient care. So use them widely and wisely. And yeah, this is it for my presentation. If you are interested into the core outcomes in general, please check the COMET website, but also follow the development of the GenderCOS project, because it's a really big project and we are really proud of it, and there is much more to come. And with this, I thank you so much for your participation and for your attention, and I'm very happy to take any question that might be in general for the GenderCOS, but also in general for core outcome sets and what we have done. Can you send the last link, please? Is it the GenderCOS? You mean the one from our project? Yeah, of course. I will paste it here in the chat. Yeah, you can follow all our updates on the project, what we have done already. We have published the list of core outcomes recently, and we are now about to publish also the results from phase 2, so the how and when to measure those outcomes, and will hopefully will be out soon, and this will complete the project.
All right, then, if there are no more questions, we can conclude the meeting. Thank you so much, Matteo, for that incredibly insightful and engaging presentation. And I will definitely be having a look into your organization, and I hope the participants will too. We're so glad to have you as a part of STEMQuest 3.0. And of course, thank you to all the participants for attending. And if there are no more questions, we can conclude the meeting.
That's great. Thank you so much, everyone, for being here, and Happy New Year to everyone. And yeah, we'll keep in touch. Feel free to email me or reach out on my social media for with any question and curiosity about these or other projects. Thank you so much.
All right, with that, we'll conclude the meeting. Thank you, everyone, for attending, and thank you, Matteo.
Bye bye.